Hi viewers, welcome to Moneymantan TV. Today we are with Sia Ammal sir. Today's topic is Indian generic wave next year set into sink obesity.
Yes.
Sir, what is this news regarding sir?
See, this is the information. It is the information that I am receiving is the drugs required, means the medicines required for obesity, weight reduction,
Okay, yeah.
are going to be reduced.
Okay.
Indian India is facing a lot of problem of obesity. Of course, compared to other countries, India is better. But
Okay.
obesity means overweight.
Yes.
So the many medicines used for overweight price is going to be reduced.
Okay.
The coming means obesity drugs, medicines used for reducing the weight, that is obesity, all price is going to be reduced. Why and how?
Why and how?
This happening is because of many top Indian companies, Cipla, Torrent, Sun Pharma, and other companies are proposing to manufacture generic versions of these medicines used to overcome obesity.
Okay.
Until now, by Denmark drug makers were having this patent rights. So by next March, all the patent right period is going to be over. So from 2006 onwards, 2026 March onwards, it becomes out of patent. So these are other companies, those who are manufacturing in India, top companies, are can manufacture these medicines used for obesity, and they can reduce the price as generic drugs. About 20 years patent right is generic, it becomes generic automatically.
Okay.
The companies which are thinking of manufacturing are Dr. Reddy's, Sun Pharma, Cipla, Mankind Pharma, Torrent Pharmaceuticals, Zydus Life Sciences, Eris Life Sciences. All these companies are planning to manufacture these obesity medicine as generic drugs. If the product is manufactured as generic drug, the price will be reduced by 80% to 90%. Means it will be available for 20% or 10% only. That will reduce the cost of medicines for obesity patients.
Okay.
And these drugs are not only for obesity, there's also diabetes also. It will become easier and cheaper.
Okay.
See, India is filled. India is many diabetic and obesity patients. They require regular drugs, regular medicines, and for them the cost will be reduced. Means the 80%, 90% reduced means their financial burden will reduce. So this is the concept, and when only it comes out of trademark patent rights of 20 years, then other companies can go manufacturing and generic drug. So after March 26 onwards, any company can manufacture this drug, which is now held by Denmark company. So it depends upon the dosage and period. The cost will reduce.
Sir, why they are increasing the drug price, sir?
See, what happens is those who are spent much money and time in research and development the first time, they want to recover that amount. For that purpose, they may be spending years together, innovation together, and spending. So sometimes it may be waste, sometimes it may be damage. All to recover all these losses and cost and future gains also, they'll increase the price. That is held by that IP, that is patent right is held by Denmark company until now.
Okay.
It is valid for 20 years.
Okay. Okay. So
So
it's going
by next March 26, this period is going to be over in India. So all these Indian companies which are manufacturing other drugs, now will be allowed to manufacture as a generic drug. Means when it is out of patent, everybody can manufacture that. So when they are manufactured, the price will come down from 10 rupees to 2 rupees or 1 rupee like that. The company which is spent for research and development, they recovered that, and which are manufacturing copy. So which is for weight loss, diabetics, all these things will be for less cost and less financial burden on the patients. Injectable component also can be manufactured at low price
okay.
after becoming generic. This price, the GLP-1 drug prices can fall by 20-80%, and other the other medicines can be fall by 90%. Means only 10%, 20% price you can consume the medicines as earlier. Means that will reduce the burden, financial burden on the patients. But all these are chronic diseases. We have to live with the disease until continuing life. So this reduction in the financial burden will definitely help the Indian citizens to reduce the expenditure, and they can go for saving also, and that will reduce the financial burden, dependence also, and that will show the strength of Indian pharma manufacturing capacity also. See, these are the things which are helpful to Indian patients. Now, nearly 8 to 9 companies are ready to manufacture this obesity and diabetics drugs, a generic drug from March next year onwards.